You watch other videos in our series, you're kind of aware of the factors that can decrease male serum testosterone levels and are kind of educated about how crucial testosterone is for your well-being. So really the next step is to kind of see where your testosterone levels are and kind of decide and investigate if it is something that is a good solution for you, right? So let's start. So we are going to go over in this video a little bit context on kind of why to seek out TRT, how to use it. We'll kind of go over why it's important for guys, especially to take ownership of their health and kind of learn about, the primary symptoms of low T. And we'll kind of go over the testing and biomarkers necessary to qualify for TRT, the life markers and so forth. So let's jump into it. Okay, good. So living with testosterone deficiency is kind of like a silent pandemic today because a lot of guys and our society as a whole aren't really aware that low testosterone levels are an issue. Most guys just kind of end up walking out of doctor's offices with kind of scripts for the wrong things. So, sometimes it's SSRIs. So, uh, you know, depression meds, which kind of end up worsening their symptoms and overall health. Sometimes it's just ED meds like Viagra, right? And so these types of meds only treat kind of the, superficial symptoms of low T, right? But they don't kind of go to the root cause, right? So low T kind of symptoms, depressed moods, low drive, tiredness, fatigue, or things like that, right? And so that's kind of the challenge, right? So, as we age though, however, right, testosterone levels just naturally decline, right? Your endocrine system kind of slows down as it were. And low T is just kind of a problem for men of all ages, not, just men under, not just men over 35 or so, right? So there's a lot of factors currently that are kind of working against guys, especially with regard to testosterone. So stress, diet, pollution, kind of, the plastics, right? Phthalates, kind of parabens that are found in our everyday products, right? Household products, right? And so that's not the best thing. And so basically, there is a lot of information out there on testosterone replacement therapy. Sometimes some of it is not, the soundest, and some of it is kind of a little misleading. Some of it kind of is kind of reinforcing the stigma, right? So kind of we want to just clear up a few things with regard to TRT, right? So with regard to TRT specifically, injectable testosterone is it's a controlled substance in the U.S. Sometimes an uninformed public kind of views it no better than kind of using steroids, or everyone wants to be a bodybuilder or so forth. So they've kind of demonized it a little bit, and it's kind of one of the biggest challenges overcoming that stigma that it really isn't kind of something that is horrific or terrible or something that you're using to for negative purposes or abusive purposes, right? It's kind of like a stigma that all of us have to get over in using TRT. So, if we think about it in other words, there really isn't anything ethically wrong with kind of optimizing your own testosterone levels any more so than maybe like taking a statin like Lipitor to kind of lower your cholesterol, right? So, there are dozens of ways society kind of accepts the use of, I guess, drugs for the sake of our health and well-being on a daily basis. And TRT, testosterone, shouldn't be any different. So I guess another story is like, if you had like a headache, right, would you be like, oh, okay, I'm, not going to take this aspirin? If you're tired in the morning, aren't you going to pound that Red Bull or, get that cup of coffee, right, to kind of get some jazz and get ready for the day? So optimizing your levels of testosterone shouldn't be different. And so, our theory is that TRT should be and will be kind of widely accepted for men who kind of want to live at their peak mental and physical state and kind of want to achieve greater heights, right? So, as we think about kind of low T and so forth, right, we have to think about like what it means to have it, right? So what it means to have it really is like, do you have these symptoms, right? And so really what we're looking for is just a variety of these symptoms, right? So mental fogginess, kind of a little bit of a decline in focus, right? So being a little indecisive, kind of some, fatigue, basically, not being able to be as productive as it used to be, a decline in kind of drive, right? Libido, ability to kind of reach orgasm, things like that. So another thing is in the weight room, are you kind of putting up what you used to? Are your workouts as good? Are you getting as good recovery, right? Overall kind of enthusiasm or, quality of life, enjoyment of life, right? and kind of maybe some like change in behavior. You're not yourself. You don't feel like yourself. You're like, what's going on, right? I used to be X. I'm not, and so that's kind of strange. And so typically if you kind of, experience constantly a few of these, 3 to 4 of these symptoms, it may make sense to consult with a doctor about potentially leaving it and getting onto TRT, right? So there are a few questionnaires that are sometimes used as diagnostics, and we'll kind of cover them, the ADAM test and the AMS test, right, for qualifying symptoms of low T. So, we'll kind of go over that, right? So ADAM is kind of short for smart language, right? Androgen deficiency in aging males, and the AMS, aging male symptoms. Their surveys are kind of used to coincident with blood tests to kind of give you the most complete picture of your health. You might have kind of known that the ADAM survey is kind of a few questions, 10 yes or no questions, right? And so, if you say yes to basically 4 or 5 questions, you may or may not have low testosterone. Most likely you may have it, right? From a kind of a clinical observations perspective, right? So AMS is kind of the different one. AMS, right? That's 17 questions, kind of divided into a few quadrants. So psychological, physical, and kind of the sexual symptoms, right? And so really the most important consideration for TRT is kind of from an analytical standpoint is first, hey, are you exhibiting these symptoms? Are you observing these? And secondly, right, is it backed up by the measurements of the blood lab tests of free and total serum testosterone levels, right? So that's kind of like if you're out of range for those, that's kind of a deciding factor of why you should pursue TRT, right? So really, in terms of just the optimal ranges, it's interesting because a lot of the lab providers have kind of lowered what it is in terms of being in the normal range to reflect kind of the average man in our society today, which reflects kind of an increase. The average guy in our society today is reflective of an increase in metabolic disorder, insulin resistance, and obesity, right? We're bigger and unhealthier than we used to be in the past, right? And so unfortunately, normal ranges as produced by our providers have come down a little bit, right? So since kind of if you think about the guys and the diversity of population, the U.S. guy population, the male population, there really isn't like a way to standardize all the men into a standard patient model. All of us kind of react to TRT differently. Some of us are more insulin sensitive, some of us are more estrogen sensitive. We aromatize testosterone more than others, right? And so there's no really like normal range, right? It's kind of false to be like, hey, this is the normal range for all the guys in America today. And so, there are different normal ranges, right, for even all of these blood lab measurement companies, right? So I think, it's the challenge is basically there's a variance in their assessment between total and free and quote unquote healthy young men. And the labs, while they give you good results, they're very accurate if it's blood tests, right? You judging on like what is normal on the answers they get on the lab tests may not be the right thing to do, right? You can't really rely on them to determine what is normal and if that is normal for you. So sometimes, just kind of relying on blood levels as an indicator only solely if someone qualifies for TT maybe is not the best thing. And it's tough because, for doctors today, that some of them might assume that, if you only qualify if you're below X level, right? Regardless of your clinical observations. And so, that's not necessarily the case. Qualitative and quantitative are required. So how you feel, kind of what you've observed is very important because, just because of the spectrum of guys and diversity of guys in the U.S., right? All of us have different levels, and different levels we respond to different symptoms, right? So we kind of really need to dial in with your doctor and look at the whole picture of your health, then kind of on just some, 2 or 3 numbers and try to be off the standard, right? So, I think as we think about it, right, we really kind of want to go hear, what patients are kind of feeling. So really it's important to kind of go and determine what symptoms are and make sure kind of you are a candidate, right? Typically if you're above kind of 600 nanograms per deciliter, you may or may not be a candidate, right? There are always exceptions to the rule, but under like kind of normal circumstances, it may not be nearly enough to possess low to low normal blood normal test levels, right? You got to have some of the 4 or 5 kind of low T symptoms, right, as mentioned on the ADAM or AMS kind of tests, right, to kind of qualify for that prescription for TRT. So, really, if you kind of get this right, you should kind of meet 2 of the 3 markers in order to kind of go through TRT. There's always exceptions to the rule. Numbers alone cannot determine if you have it. Numbers and observations and symptoms could help you, right? And so it's kind of good to have a holistic versus kind of an absolute perspective, right? So, these are just kind of generic markers, right? Research shows that kind of testosterone deficiency, unfortunately, is affecting younger men at a higher rate than ever before, right? So kind of if you are in your 20s, you may want to proceed a little bit with caution. We have noticed a lot of those in 28, 29, 30s, kind of that age range, having some deficiency issues. And so, you really want to kind of see if you're in that demographic, hey, like, can you do what you can to maximize natural production, right? If it's working out, if it's cutting out sugars, alcohol, kind of getting leaner, kind of just having better habits, right? To see if that works, then go for it. And then if it's not working, right, and you're getting worsening symptoms, then it may make sense to kind of go with the blood lab test, right? To kind of see, what's going on, why you feel the way you do, right? So, remember, it's not to say if you're in the upper end of 500, 600 that you don't qualify. It just kind of, these are some kind of, high level measures, right? And so, we shouldn't just judge you just based off the numbers, right? Symptoms are very important, right? So if you do experience symptoms of low T, as recognized by the clinician, that's really important. And so ultimately, kind of, working with a doctor has to kind of weigh all these factors to kind of determine whether or not you should proceed with TRT, right? If all these kind of apply to you, it probably makes sense to go for TRT. A few, if 1 or 2 or 2 or 3, think about it. Just first go for the blood lab test to see what's going on, and then you can kind of proceed. Okay. So as we think about, those under 30, basically it's important to kind of work, as we mentioned, alleviate symptoms of low T by working on nutrition, kind of cutting out body fat and inflammatory markers. So cutting out sugars, alcohol, so forth, kind of having better sleep hygiene, right? And making sure that, we can see if you can go without it. If the lifestyle changes don't dial up your hormone levels, the natural T boosters aren't working for you, then it may make sense for us to kind of work the next level and see what we can do to make sure that we can kind of maintain your current health and not, obstruct anything with fertility, right? There are things that can be prescribed to maintain fertility and sperm motility while you're on TRT. And that is designed to kind of make sure you retain your reproductive capability. And so let's just kind of go into kind of, the recap of what we have kind of covered, right, in this, right? So covering everything here, kind of summarizing it, we talked about kind of that huge epidemic that guys face today. It's kind of silent, it's kind of controversial, right? And so low T is kind of approaching men of all ages, younger as it is. And so we kind of covered primary symptoms of low T. So, mental fogginess, indecisiveness, lack of, energy, drive, things like that. The 2 questionnaires that are used typically by physicians to support a clinical diagnosis. And it's like, if you are experiencing any of those symptoms, right, you want to kind of work closely with the doctor, test it out, and see if a clinical diagnosis makes sense. So, after a blood test, it typically does make sense to work with a doctor to look at the whole picture of your health. It doesn't make probably much sense to, rely solely on 2 measures, total and free. You need to kind of see the symptoms. You need to kind of think about, how your observations, what you observe, quality of life, kind of where you want to go, right? And so, it's also important to make sure that, if you are, under age of 28 or so, and your test levels are not lower than 600, right? Or kind of that you're not experiencing symptoms of low T, kind of be careful, right? But remember, low T basically is a holistic diagnosis, and it's not just one, one strict, oh, you're below this, therefore you are, right? And so that's why we just kind of wanted to give some further clarity onto this, that kind of diagnosis. All right, so that's that for now. Thank you so much for attending, and look forward to showcasing you some more information about TRT.